Hello viewers from wherever you are joining us around the world. It is yet another edition of the Rebound series that comes to you only on the Heart and Soul digital platforms. My name is Farai Mwakutuya. Today's program is brought to you with the proud support of the Zimbabwe Coalition on Debt and Development, ZIMCOD. We are today focusing on COVID-19 vaccine rollout, the administration of those vaccines, experiences that members of the public have been having and sharing with us, but also finding out just how smoothly that process is going. Are we on track? What are some of the challenges and what can be done to iron them out?
I'm waiting to be vaccinated today so that we can protect ourselves from the spread of coronavirus. And I think this is a very good move so that the nation will be protected from the spread of coronavirus, as well as improving our lives, as well as the working environment will be conducive for working.
The first jab, it was quite a difficult decision to make, but I had to do it to just protect myself from the COVID-19, which is very real. So I decided to take the first jab as the first step into protecting myself.
Ndakatomboedza several times ndikaenda mune dzimwe nzvimbo ndichiedza kuti nditsvage vaccine. It's unfortunate kuti ndangosvika zvichinzi pane second vanhu vari kubaiwa the second line, so ndaitoti pamwe zvichatondijambawo. So nhasi pandanzwa kuti kunoku kuri kubaiwa vekutanga, ndaona zviri chinhu chakanaka kuti ndiuye ndibaiwe vaccine iroro. Zvazvinoita pakutanga taitombotyawo tichingonzwawo mashoko evanhu vanotyisidzira, asi pari zvino ina handina kutya, ndosaka ndauya ndoga pano ndisina kumanikidzwa kana kudii. Ndazvipira kuti ndoda kuti ndibaiwe ndidzivirire mikana yekuti ndinobatira chirwere cheCovid-19.
To help me unpack this discussion, I'm joined by three guests. They are the Honorable Nicola Watson. She's a member of the Parliamentary Portfolio on Health. Welcome to the program, Honorable. We are also joined by Honorable... Great. Alongside her is also a member who sits on that very same committee, Honorable Daniel Molokele. Sir, great to have you on the program.
Thank you so much for inviting us here. We are very happy to be here.
And very lastly, we have Cheryl Tendai. She is a Social and Economic Justice Ambassador. Cheryl, thank you for joining us on the Rebound series.
Thank you for having me.
Great. Now, let me begin with the two honorable members of Parliament. What we do know that certainly over the last few months, since February when the COVID-19 vaccination program began, several millions of doses have been procured and brought into the country and are currently being rolled out and administered to members of the public. From your own insights, from your own observations, could you tell us how that process is going? Your observations as a committee, but also as MPs who represent people in different constituencies. Is the process going well and smoothly? I'll begin with you, Honorable Watson.
Thank you. I'm not so convinced that it is going as smoothly as it could go. I think that's from a constituency level. I'm not sure that as a committee we particularly discussed the vaccine rollout yet, because there are insufficient, actually, particularly in Bulawayo, vaccine centres where people can get vaccinated. There is also, in another group this morning, I discussed it, there's a dearth of information. There's insufficient information dissemination. So I think that it could be a lot. It's going, undoubtedly. People are very keen to be vaccinated. Queues are there, huge. People are asking constantly, where can I go for this jab or that jab without standing in a queue for 4 hours? So I think the will is there. I think that we need a greater decentralization of vaccine centres. I think that would help a huge amount.
Indeed, Honorable Molokele, your input.
I think the way we've been doing the rollout so far, I've not been convinced, especially in terms of administration and logistics. It's been a trial and error approach. We seem to be learning as we continue. In Hwange Central, where I'm from, I know that one of the biggest challenges has been the number of allocated testing centers, so to speak, vaccination centers. And there are very few at the moment, and there's a push that we increase the number because there are long queues, and those queues are discouraging a lot of people from accessing even the first dose. But it looks like it's actually easier to get a second dose because the queues for the second dose are less. And we could do better as a country. I read somewhere that Zimbabwe is doing better than other African countries. I'm not sure how far true that is. But if the standard of Zimbabwe is very high, then I'm very sad for Africa at this moment in time. Because when you compare with Europe, for example, they are way ahead. I know that, for example, in England, the English Premier League commenced over the weekend. And I was very fascinated to say, while Zimbabwe is on strict lockdown conditions, those who went to watch Arsenal Football Club were actually not wearing face masks. There was no social distancing. The stadiums were full to the capacity. And that is linked to the herd immunity concept, to the vaccination concept. So we are way behind Zimbabwe, and we need to up our game at the moment.
Indeed. I think, certainly we've all seen those reports that indicate that Zimbabwe is certainly doing better than other African countries. I think those statistics point to the number of vaccines that we've been able to bring in, the number of people that we've been able to inoculate thus far. The point you've just made about it's easier to get a second dose. I remember at one point speaking to Ministry of Health officials who had said that, they were prioritizing the second dose because I think of the implications where you don't want someone to get the first dose and then fail to get the second dose in time. Those are some of the challenges. We are learning as we go, aren't we? As you quite rightly say, Honorable Molokele. So commendable, wouldn't you say, given that we are in this challenge where we are learning as we go? This is new to everyone.
I think we are definitely in a positive trajectory, especially during July. We saw a real push in terms of the vaccination program in Zimbabwe, where all age groups were encouraged to come, and we have seen a massive increase. And we do have herd immunity. For example, in the city of Victoria Falls, there was a successful vaccination program. And from what I understand, is that the city of Victoria Falls is actually the first place in Zimbabwe to have herd immunity. And so we're on the right track, so to speak. But I'm very clear that we could do better. And the real reason why it's very difficult is because there's a lot of political consideration in rolling out the vaccination programs. And we would have wanted maybe the public health professionals themselves, the public health practitioners, to be the ones at the front, and some other expert skills around logistics and administration. But you will see that most of the decision-making process goes back to the political powers. And that, in my view, is really unfortunate, because in other countries, you will see that the response is mostly being led by experts and not political actors. And we need to depoliticize this response.
Let me just take you on that, sir, where These vaccines are being rolled out to as many centers. We see them being rolled to as many centers as possible. It is open for anyone who wants to go and get the vaccines. When you say politicization, what exactly do you mean?
Yeah, you might be aware that our communication strategy, and it's one concern I raised already, that if you look at the communication strategy around vaccination, most of it is not coming in the public domain. It's coming through social media platforms, through the community networks that people are part of. And so at the end of the day, you have a situation where access to information is getting to some people first, and they have to be aligned to a political party. And they are more privileged in terms of accessing information so that they avoid being part of the queues and so on. So there's a lot of political considerations involved, and this should be a national program. This should be depolitical. And in my view, I feel that members of a certain political party, which I don't know whether I'm allowed to mention the party, but as a parliamentarian, I can confirm that there is some kind of favoritism in the rollout program, and it's really unfortunate.
Let me bring in Cheryl Tendai. She is a social and economic justice ambassador. We've just heard the honorables talk about some of the challenges that are being faced in the rollout, or that certainly that they have observed. Do you concur with this, or are you of a different mind?
Absolutely, I am in total agreement with the honorables. Looking at Chitungwiza, where I'm from, there are very long queues at the clinics, insufficient centers, like Honorable Watson has alluded to. We have very few centers, and yet we have large numbers of people who want to be vaccinated. And the process has somehow interfered with their day-to-day lives, where some people have actually been asked to not report for duty if they haven't produced the vaccination card. And then you have to go and queue at the center, maybe wake up at 4 to be at the front so that you can get vaccinated. So you see that there are a lot of inconveniences associated with the vaccination program. In as much as you're doing better, then there is a lot of room for improvement. We cannot be rejoicing right now that we are doing better as Zimbabwe in the African continent. We cannot be rejoicing right now. We actually need to improve. And also from dissemination of information, you find that there are a lot of conspiracy theories associated with the vaccine. So how then do we ensure that the public is fully informed so that when they go and get vaccinated, it is an informed decision that they are making and not just feeling like they're being pressured into something that they do not want to do or something that they do not understand?
I'm going to come back to that issue of messaging, communication, coercion, as some people may want to put it a bit later. But right now, you mentioned the issue of favoritism, or as mentioned, favoritism, people getting to the front of the queue. We have also heard stories of people bribing to get to the front of the queue or get access before others. Some even bribing to get fake vaccination certificates. Is this something that you've also come across? How prevalent would you say this is?
I have actually come across two people right now. In Chitungwiza, we have two hospitals. There's Chitungwiza Central and then there's CityMed, which is a private hospital. So it is alleged that CityMed is charging $2 for the vaccine. If you do not have $2, then you may have to queue up as early as 3 a.m. and then you get a number, then you return at 8 when they've started the vaccination process. But if you have the $2, then you can come in maybe around 9, anytime that you want, you come in and then you get vaccinated. As far as the issuing of the vaccination cards to people who haven't been vaccinated, that one I am yet to come across. I cannot say that I have come across anyone who has bought or acquired a card without being vaccinated.
Honorable Watson, in Ulayo, your experience, or have there been reports of this where people are cutting queues, getting to the front of the queues? I know certainly senior citizens get free access. My mother was vaccinated the other day and she went to the front of the queue, but we also know that there are some people who are using influence to get to the front of the queue. Is this something that is prevalent and happening there?
I can't say I've come across it particularly. I've had anecdotal, I can say, evidence, if you will, of what people call placeholding, where there would appear to be people who've been there and hold places for others who then come later. The other, I have certainly not come across anyone with a fake card or who's claimed to have been issued with a fake card. I can't say I've come across that at all. But I would just like to put in a comment here with Honourable Molekele and the herd immunity. I think that I want to go back to his point about the scientific evidence. The actual science, this is, I think, what he was really trying to say. The science behind everything we're doing seems a little bit sketchy. For example, lactating mothers were from the beginning discouraged. Pregnant mothers and lactating mothers were discouraged from being vaccinated. I've seen anecdotal evidence where women have actually just gone and got vaccinated themselves, lactating or not. You know why? There are doctors saying, no, it's fine. In fact, it's a very good thing for a lactating mother to get vaccinated. We're very short on information and science. And also, please, my grandmother used to say, comparisons are odious. Why do we say, oh, Zimbabwe's doing better? We want to do best for ourselves. So what does it matter what others are doing? It's what happens in Zimbabwe that's important. Thank you.
Indeed. We must take a short break now. We'll come back and continue this discussion here. We're obviously today focusing on COVID-19 vaccine rollout and the challenges and experiences that people have been going through during this period, as there seems to be a rush now at those vaccination centers, people trying to get inoculated in time to access and benefit from certain privileges, access certain areas, workplaces, as is emerging now, which is something that we'll also talk about when we return. Stay tuned. It is the Rebound series.
Makliniki arimo mudhuze momo vanofana kutumirawo mishonga iyi kuti vanhu veruzhinji vaite sei vabaiwa, nokuti vazhinji havasati vaita sei vasati vabaiwa. Saka vamwe vane dambudziko rekushaya mari dzebhazi kuti vachienda kuuya kuzobaiwa. Sasi vakatumirawo mishonga mune nzvimbo dzakasiyana siyana munhu ese anokwanisa kubaiwa.
Tingangoti vaccine inongoda kungoiswa makliniki ese kuti vanhu vaite sei wabaiwa wakawanda, because zvakangofanana sepapapa because iri kungowanika kunhu kushoma handiti. Saka vanhu vari kuungana zvinozvikonzeresa futi kuti vanhu vabatwe necoronavirus. But chandinotongoona ndechekungoti ngaingoiswa kana mumakliniki, vanhu vangotora variko kumakliniki vanenge vari kwavanenge vari koko.
I think if you increase the number of vaccination places, like into our residential areas like Budiro, Mbare, if you just increase the number of vaccination places, as you can see here at Parienyatua, there's so long queues and it's taking ages to get vaccinated. But if you increase the numbers of vaccination centers, I think most people will get there and then they'll get vaccinated in a shorter period of time.
Saka kwandiri ndoona chiri chinhu chakanaka kuti tibatsire nyika yedu ifambire mberi nedzimwewo nyika dzakativakiridza. Tose tikavaccinwa mikana yokutransmita chirwere ichi kana kuti yokutapurirana urwere inoita mishoma, zvogobatsira isu savanhu senyika sepasi.
Welcome back to the Rebound series. My name is Farai Mwakutuya. We continue this discussion looking at COVID-19 vaccines and the rollout. One of the points that all three of my guests have pointed out and made reference to is the communication, the messaging around this, that there isn't adequate information. We've heard jingles on radio, on television. We've seen adverts in the paper. We've seen push on social media to say, go out and get vaccinated. Is that not adequate? What further information do you think we should be pushing out there? I'll begin this time with Cheryl.
So to begin with, let me cite an example of the types of vaccines that we have. There's Sinopharm and then there's Sinovac. And there are people say Sinovac is actually not real compared to Sinopharm, and there are more complications associated with Sinovac compared to Sinopharm. So there's more preference for Sinopharm compared to Sinovac, and that, well, where people are getting that sort of information, well, we do not know. So there needs to be clarity on what each vaccine contains. And also if there are, like, as mentioned earlier, if you have underlying conditions, then this one would be better for you compared to the other one. So maybe to begin with, what is in the vaccine and how does it affect your immune system as a human being, as a person? And then we go from there.
Honorable Molekile, you brought in the issue of politics earlier. Given, unfortunately, that we are in a quite polarized environment, it may be a risk that some people may simply not adhere or follow messages that come from a political party that they are opposed to. Do you think, therefore, that the messaging should be led by scientists, by doctors, by those professionals? Do you think that has had an effect on the uptake of vaccines, the fact that this messaging seems to be jingles which are associated with elections and certain political parties, and some people may simply be opposed to the fact that it is them telling us and so we won't do it?
It's true, because you remember that there are elections coming soon in this country, and it seems that the government is more interested in making sure that they come up with good ratings from the communities who are the prospective voters. So instead of worrying about the public health consideration, the emphasis is more on scoring points. And the political parties that are involved, both the opposition and ruling party, are all anxious not to lose face in the COVID response. And it's very important that the leadership of this process comes through more through medical health aspects or public health aspects, which up to today in Zimbabwe, we struggle, because if I ask an ordinary citizen, which public health aspect are they associating with the COVID response, you will struggle to know. But they know politicians or civil servants that are aligned to the political process of this country. If you go to the neighboring countries such as South Africa, there are prominent academics, experts, professors that are now associated. When you see that professor on TV, you automatically focus, because you know this is the man who the country is looking up to for opinions around the COVID response. In Zimbabwe, we don't have like universities, medical schools being publicly associated with the vaccination process. It would have been easier to get a professor at MSU Medical School or NAST Medical School at UZ Medical School to be the face, or professors, medical experts, to be the face of the COVID response. And they will speak in the language of public health, which is the problem that we have at the moment.
Honorable Watson, is there anything wrong, or should people be worried now that we start hearing, oh, you can't report to work if you're not vaccinated, you can't access certain places if you're not fully vaccinated, you can't go to church, for instance? Is that not a form of coercion, being held ransom?
Yes, I think that it is a form of coercion, because if there were sufficient vaccination centers, if we didn't see long queues of people waiting to be vaccinated, you might sort of not feel quite so coerced. And freedom of choice, it's a great debate. I've had people screaming at me about those issues because they say it's my right to choose not to be vaccinated. And I say, well, then you have to take into consideration the right of the people who've chosen to be vaccinated. And again, I think we in Zimbabwe have lacked the medical and scientific explanations as to why it's so important for everybody to be vaccinated. And then we haven't provided sufficient vaccination programs to make sure everybody is vaccinated, if you get where I'm coming from. Yep. It's really a double-edged sword, that, for me.
Yeah.
Very difficult. Very difficult.
Are the challenges we see with the long queues the fact that perhaps there aren't enough? You said that we need to decentralize it more, and I'd imagine that these vaccines need to be handled by certain professionals and in certain environments. So it can't, perhaps it's a lack of infrastructure that's disabling that's hampering the ability to decentralize more. I've heard, for instance, people.
Yeah, to an extent. But for example, in Bulawayo the other day, they did certain shopping centers in areas where there are no actual council clinics or medical facilities for vaccination, but they didn't advertise. So if a resident hadn't driven past and said, oh yeah, guys, you can go to Morningside shops, there's people there vaccinating, who would have ever known? And also then the question was, are they doing first jabs? Are they doing second jabs? Are they doing both? You know, it's great, but you really, really seriously need to do those programs. And particularly, I think in Bulawayo, where actually there are, there are areas literally where there are no public health institutions and no council clinics, huge areas. There are peri-urban areas where information, you can have as many jingles in a radio program as you like. You can have newspapers, you can do it. That doesn't get to those people. And no one's going to them either to say, look, what are your problems? I've been to one of my peri-urban communities as an MP and said, look, if you want to go and get vaccinated, you have no ID, you have no, I'll do the letters for you, no problem. So these are issues. And if somebody isn't going out there, reaching out to those people, then how does it work? It's not great. And also, sorry, if I can just say, Matt's there are huge issues because in those very spread out rural communities, again, there are places where people, A, don't get the information, and B, for them to get to a vaccination center is almost impossible. Or, it's a huge fight.
It's a huge distance. Honorable Molokele, this point that has just been raised, peri-urban, but I would say even rural, because I know at the onset of the COVID-19 vaccine, there seemed to be this sentiment that it's an urban sort of disease because it hadn't reached the rural areas. Certainly the first wave was mostly confined to urban centers, but now, it is pervasive, it is everywhere. We also hear that, certainly I've heard reports that MPs have been engaged, chiefs have been engaged to try and spread the word of vaccination. Is that really happening? As MPs, have you been engaged to go out to your communities, to reach out to chiefs, to reach out to community leaders, to say, let's spread the gospel of vaccination?
I think as parliamentarians, we've been paralyzed because remember, Parliament is now meeting virtually, and they've said only 20 legislators should come to Harare per week. At the same time, they've said those legislators who are able to come and get fuel coupons in Harare, you can feel free to come and collect. And you are talking to someone who is in Wange, 800 kilometers away from Harare. So in terms of money and resources, we do not practically have. So we've just been doing as much as possible, especially through social media platforms to help. But in terms of rural areas, peri-urban areas, you need physical sort of outreaches, maybe with a loudspeaker, a hailer, with a truck, encouraging people and educating people. That has not been happening. I also wanted to emphasize an important point that the radio and television jingles are not that effective because a lot of people, especially in urban Zimbabwe, don't actually listen to ZBC or watch ZBC, or they don't even read the Herald or the Chronicle. So what we do have in Zimbabwe is a lot of satellite television. And for the last 20 years, everyone knows that Zimbabwe is one of the most satellite decoded countries in the world. So our access to television is mostly through DSTV and so on. So I think what the government of Zimbabwe is missing is the fact that the most important source of news in this country is now social media. You have to use Facebook, you have to use Twitter, you have to use WhatsApp. They are very effective. Even those jingles, they can custom make them for social media platforms, and they will reach out to more people if they are custom made so that they don't consume a lot of data and so on. And more people will be able to access that information. And in fact, there is another important truth. A lot of the misinformation and disinformation that Zimbabweans currently have about the COVID response, about vaccination, is coming from WhatsApp and so on, because people have viral messages, some so-called professor giving a theory and explanation, talking about side effects of vaccines, and that goes viral on social media.
And as you quite rightly point out, the government messaging is not on those platforms where it could actually be countering and leading the narrative.
Yes, and it's very important for our government institutions to adapt to the impact and influence of social media, and also knowing that Zimbabwe is a very young adult population, so to speak. So we're one of the youngest sort of countries in the world. So most of the people in Zimbabwe, they are below the age of 40. And the best way to access them today is not through ZBC or Herald or Chronicle. It's through WhatsApp, Facebook, and Twitter. And those even in rural areas, they can at least access SMS or WhatsApp. And those are very effective skill in rural areas. I know some people say in rural areas it's a bit difficult, but if you custom make messages so that they don't consume a lot of data, they reach out to a lot more people. And I think WhatsApp is the most influential source of news in this country today. And the messaging is not there on WhatsApp.
Cheryl, let me bring you in here. There's a question I asked earlier where I'm saying, and as a social and economic justice ambassador, perhaps you can be best placed to comment on this. Are you worried that, people are now being coerced and forced to take these vaccines because they are being told you can't go to work, for instance, you can't go into certain buildings if you're not fully vaccinated? How do we handle that? Or should we be incentivizing people to say, as we see in other countries, get money if you prove that you're vaccinated?
It is indeed worrying because as it stands, like we initially said, we do not have enough vaccines that can actually accommodate everyone. We do not have enough centers. So if it means that I'm now being deprived of a service because I am not vaccinated, of which I cannot access the vaccination, it is indeed worrying. But if adequate information is provided to the people, like Honorable, the speaker before me just alluded to, government needs to be to make use of mainstream media, to make use of social media that where young people are found, and also ensure that there is no false information or there is minimized false information, disinformation of people, so that everyone is informed of why they are being vaccinated and whether or not they can access a service or where they can actually get vaccinated, right? Mm-hmm. So and also to come in with the issue of staff at our local clinics or vaccination centers. For example, where I'm from in HStvZim, the local clinic that I got my vaccination, it is so understaffed. You find that there are people who are coming for VMMC, people who are coming for HIV and AIDS testing and counseling, people who are coming to get vaccinated. We have lactating mothers who are coming. And then there are very few people who are supposed to be attending to everyone. So you find that the staff is overwhelmed and you still expect them to vaccinate people at a faster rate without looking at the other responsibilities that they have. So why are we not making sure that there is enough manpower at our vaccination centers so that everyone is attended to in time so that I can get back to my everyday duties without being inconvenienced, without having to wait in a queue for 4 hours?
Indeed. Let me stop you there, Cheryl. We need to go for another short break. It is the Rebound series, and we'll be back shortly.
With regards to the vaccination program, Farai, everything is going very well in my area, that is in my constituency and actually in Midlands. Health centers like hospitals, clinics, they are offering vaccination programs. People go in and have their first doses or second doses. But what is happening is the community is also helping the government by providing their own initiatives. Like in my community here in Sherwood, local farmers and local business people have mobilized the resources and facilitated the movement of health workers to their farms or to their business centers so that the people or workers can be vaccinated from where they work. That initiative has really worked. Because, for example, Farai, at this farm here, I've got around 62 workers, both on contract and permanent workers. One day, when we mobilized the health team to come here, and the workers here, 82 workers were vaccinated. And our neighbors also who live nearer here, they also came here to be vaccinated. On the second day, we had another 62 workers vaccinated. So as we are talking right now, on this farm here, this is Pastured Farm, the people here, in my family and all the workers, they are all vaccinated. People are very happy. The feedback I get, Farai, people are now very willing to get their vaccination. At first, people were very afraid. They had fear of the unknown. They had fear of being used as guinea pigs, because this is what they were hearing from WhatsApp groups or whatever, people who were saying bad things about the vaccination program. After an intensified educational campaign, people have changed their mindsets. The COVID third wave also, the COVID third wave fatalities also raised people's consciousness about the pandemic, to the extent that right now you see long queues of people at these health centers. In Midlands, and especially in Kwekwe, which is my direct locality, I have never heard about the politicization of vaccinations. Actually, what I said is, whenever a person gets into a queue, they just line up, and questions asked or whatever conversation which goes between the health staff and those to be vaccinated, there is nothing asked about political affiliation. And I've never heard of anyone turned away because he or she is not for the other party. Yes, I am ZANU-PF, but I've never heard anyone who is not ZANU-PF being turned away. Maybe it happened somewhere else, but no, never. Not in my locality. I've not heard about it. So there is no politicization of vaccinations in my area, I repeat. Thank you, Farai.
Welcome back. It is the Rebound series. I'm your host, Farai Mwakutuya. I have three guests today, Honorable Nicola Watson and Honorable Daniel Molokele. They are both members of the Parliamentary Portfolio Committee on Health, as well as Cheryl Tendai. She's a Chitungwiza-based Social and Economic Justice Ambassador. We are discussing COVID-19 vaccine rollout. Before we went to the break, Cheryl was talking about the fact that there is need to resource these clinics, make sure that they are adequately manned and staffed. That means resources, financial resources. I want to talk a bit about that now. Begin with you, Honorable Molokele. We know that several times we've heard Finance Minister Professor Mthuli saying that about $100 million has been set aside for COVID-19 vaccine procurement. I remember at the airport a few weeks ago him saying that about 60 million of that had been utilized and drawn down on. As parliamentarians, perhaps it's maybe not your specific committee, but are these sort of expenditures the sort of things that as Parliament you should be having oversight of, to say how much has been allocated, how much are we paying for vaccines? Is this information that you have?
Yes, we are actually in a situation where, as recent as 3 weeks ago, the Minister of Finance was in Parliament, and some MPs were very frustrated because they were taking him to task. He keeps talking about surplus, he keeps on talking about some extra funds being available, but on the ground, there is clear shortage. In Wange, the COVID task force, they will tell you that they need fuel to move from point A to B. These are specific budgetary issues. So there is a gap between what the Minister of Finance is saying and what is the reality on the ground. Mm-hmm. Also, there's a very important reason why I was saying we should reduce political consideration, because if we had put in public health aspects to take the leadership, one of the obvious things that would have come out is that we actually have a precedent with the HIV and AIDS epidemic, how we responded to it in the first days. For example, with regards to human resources or manpower, we got so overwhelmed, and then we started to allow community-based volunteers to be trained to facilitate even community awareness on ARVs, to roll out ARVs, peer-to-peer strategies around ARVs and adherence. And that's how we reduce the expense of administering the response. Right now with COVID, we need to move away only sort of nurses and doctors and trained health professionals. We need to reach out, for example, to students who are on holiday or forced holidays, university college students, youth activists, and so on, to say, you are the young people, you know your own people, can you help us to reach out to them? Maybe through drama, through theater, through whatever methods that you have, through voices and videos on WhatsApp. But our students are not even directly involved at the moment. They are so creative and resourceful. If you go to the students, they are on vacation, forced vacation, there is no lectures. So we're not taking advantage. You could have trained community-based volunteers to go out into the communities and mobilize awareness and also reaching out in terms of administering the vaccine. So we can learn a lot from the HIV and AIDS response. And we don't need a lot of money to create human resources, because we already have a pool of unemployed youth in this country, not just students, but unemployed youth who would be happy to volunteer and not get a salary for that, but get a t-shirt, get some stipend for supporting a national response. And a lot of people right now are not contributing that minimal. And it's important that we learn from the HIV and AIDS response. I also wanted to emphasize a very important point around public information and disinformation. It's very important for the government of Zimbabwe to realize that the people believe the people that they trust. And right now, they can't trust the same government. Unfortunately, you can't be an expert in everything. You can't be an expert on HIV, an expert in vaccination or whatever. So that's why it's important for the government to get people from public health institutions in Zimbabwe who will come out on public spaces. And you can see this is a professor at University of Zimbabwe, Professor Dr. Watwat. Then people will trust. It's like churches. They can't use celebrities to market themselves, and then they don't use their own pastors and bishops. When you're a bishop or whatever, people listen to you more. But if I say, no, I want my church to be popular, let me ask Japreza to come and preach at my church, people will not take me serious as a pastor. So we need experts, and we actually have a lot of them. They are there in Zimbabwe, but they are not in the public domain at the moment. They are taking a back street, and civil servants who are not medical experts and politicians who are not medical experts are trying to claim the limelight, which does not belong to them. And I can assure you, everything has got to do with 2023 elections. So people, while they are busy trying to respond to COVID, they are worried about gaining marks for the elections. And that is the problem with Zimbabwe right now. Let's take the politicians out of the response. Let's have the public health experts take the lead, supported by the politicians. Right now, we can't MPs. I'm a politician. Why should I be at the front? People from other political parties will not trust me the way they will trust someone who is a medical doctor, who is an expert in public health. So we need to separate the two.
Mm-hmm. Honorable Watson, so far we seem to be having a preference for vaccines coming from a particular country that are being manufactured there. We are told that part of the reason why we haven't taken up or licensed for use some of the other vaccines have to do with cold chain facilities and their handling and things like that. But are you, as parliamentarians, asking these questions of why we aren't getting vaccines from wherever we can? Because right now, what we have is clearly not enough to meet the demand that is out there.
Yes, I think that question was asked in Parliament, and they fall back on the cold chain issues. However, we all know that, in fact, the J&J one-shot vaccination cold chain requirements are actually not as demanding, in fact, as the Sinopharm and the Sinovac. So why government are hesitating, I don't know. Perhaps it's financial, Minister of Health, I don't know. But there have been no clear answers, actually. The questions have been asked, and there actually are no clear answers as to why that is the case. So I can't really say. But what I'd also like to say is that on the budgetary issues, we also all know as parliamentarians that we get budgets, yes, and it all says looks lovely, and then it's not dispersed, or it's not dispersed timeously enough for it to be effective. So I think that in terms of the rollout and in terms of staffing levels, all these issues, we also know that our public health sector is woefully underfunded and woefully short-staffed. So those, quite frankly, issues should have been resolved long before we got this far down the road.
Cheryl, earlier you mentioned the fact that there are some places where people are being asked to pay $2 to get this vaccine. We know that in the recent past, private facilities have been allowed to start charging for these vaccines. Are we not heading into a situation where the free vaccines may end up being in short supply and the paid for ones, the facilities that have paid ones, have all the stock?
I've actually come across someone who got vaccinated, but they didn't get the card, the one that is a QR code from the ministry. And they were saying the cards are in short supply at the moment. So once we have them, you then come and then we'll transfer the information from the paper that we have given you to the card. And then there was a question to say, how are there fewer cards when we have more vaccines? Shouldn't it tally, or shouldn't we have more cards than vaccines, since the cards are locally produced? So yeah, it is highly likely that we'll have more vaccines charged than the free ones that will be distributed, because we'll into someone's pocket somehow.
I'm glad you mentioned this issue of cards, because we keep hearing this talk globally of, vaccine passports and things like that. So I've got this piece of paper, this card that I have. How internationally acceptable, recognized will it be when I say, look, here's my vaccination card? How do they prove? Is it credible when I travel?
I think the fact that it has a QR code that you scan and then it directs you to the Ministry of Health website.
Okay.
Maybe.
So that process. What I should be asking is, that process has actually been done. That QR code, actually, if they scan my card, they'll see my name, when I was vaccinated, which vaccine. Is that mechanism functional?
Apparently, I scanned my own on the day that I got it, and I couldn't get to the site. Like it didn't work. So it's a bit worrisome, because I tried it personally. It didn't work. So yeah, it's really worrisome to say, is it really credible? How then do we do we assess the credibility of it? Yes.
Sorry, can I add
something?
Please,
yes.
I wanted to say that other countries do not recognize Sinovac or Sinopharm. So even if you claim that you have been vaccinated, the airline from that country will tell you that we do not recognize this vaccine. So they have their own list of vaccines. And when you're applying for a visa or when you want to buy an air ticket, they'll actually prescribe to you the vaccines that they recognize. And unfortunately, the ones that we're using, one of these vaccines that they're not recognizing.
Earlier, I asked your counterpart, Honorable Watson, about that issue of why we seem to be having this preference. I suppose, it's about the ties that we have diplomatically and politically and economically that could be influencing this. But why aren't we getting these other ones? Have you put this question to them? Are we putting pressure to say, let's get the other vaccines? Because they also seem to have a very good efficacy. Could it be a pricing issue, perhaps?
Yes, it's a political reason. I explained from the start that not medical or scientific in approach. So if you are a public health expert, you would obviously be much more open-minded. But consideration, look, East policy, we don't trust things from the West. That's why we're going to die. Because now, instead of worrying about a vaccine, you worry about where that vaccine is coming from. And some cynical people will say it's also related to the grand corruption system that we have in place, the grand cartel system, because there are countries where it's easier to own bulk and then infuse your theft in the process. But there are other countries which are more strict. So you would rather go to countries where you are able to have an underhand deal. So some people are using COVID to get rich. So if they go to a country that is very strict in terms of procurement systems, they will not benefit from the vaccines. So there are countries that they can manipulate. And China is obviously one of the favorite countries in Africa today, where you can do underhand dealings as a public servant, as a politician, when you are procuring from China. And Zimbabwe is definitely interested in China more than any other country because of that reason. Because even the it's a gift, is free, but later I'll be told we actually paid inflated figures. What the public was told and what actually happened is not the same. So there's a lot of under-dealing by politicians, and they actually get rich out of this vaccination process.
Indeed, I think across the globe, across Africa, across the globe, we've seen this phenomenon where there have been, abuses of COVID-19 funds, this COVID-19 pandemic, and we certainly hope that in the coming weeks we may revisit that topic and look. I know that an Auditor General's report into issues to do with COVID has recently been released, so we hope that we'll certainly have an opportunity to look into that. But for today, we are out of time, and I'd like to thank my three guests. Honorable Nicola Watson, thank you so much. Honorable Daniel Molokele, thank you so much. They are both members of Parliament who sit on the Committee on Health. Thank you so much for those insights. And Cheryl Tendai, she is a social and economic justice ambassador. She's joining us from Chitungwiza. To all three of you, thank you so much for coming through to the program. It's certainly been fantastic and great to have your insights. That does it for this edition of the Rebound series, brought to you with the support of the Zimbabwe Coalition on Debt and Development. My name is Farai Mwakuti. I'm back again next time at the very same, next week at the very same time to do this again. Be sure to join me then. It is only available on the Heart and Soul digital platforms. Whatever you do, stay safe and do keep you and your families protected during these very, very difficult times. Bye-bye.